If you've ever had to wait to see a medical specialist, you might be surprised to know many new doctors are struggling to find work in this country. A recent study found 1 in 6 new specialists can't find a job. One of the problems? More senior physicians are delaying retirement. But as Shirlee Engel tells us, there isn't an easy fix.
Whether you're a patient waiting for care or a newly minted doctor waiting for a job, news that 1 in 6 specialists can't find work is baffling.
When you can't find a job after 10 years of education, the average debt load is approaching $200,000 for Canadian medical graduates. It's very disheartening.
A report last week by the Royal College of Physicians and Surgeons released shocking numbers. 33% of gastroenterologists, 43% of ophthalmologists, a quarter of orthopedic surgery grads, over half of radiation oncology grads, and 40% who chose urology, all unable to find a job. A reality Dmitry Krasikov-Enz is keenly aware of, with 9 more years of training left in his specialty, neurosurgery.
If the jobs aren't there, what are my options?
He's optimistic the job market will turn around. If not, he's got Plan B.
And I'm flexible enough to be able to broadly consider all the variables and all the options that might be open to me. And that does include places like the US, Europe, Australia.
So where does all this leave patients? The last thing Canada needs is another brain drain, but it's not as simple as just moving specialists to where there's longer wait times. Limited health dollars means limited supplies and operating room space, even for specialists who are currently working.
If you think of matching, how many doctors we're producing with actually coming up with the resources that are needed for them to be gainfully employed, then we might start chipping away at some of the things that are standing in the way of patients getting timely access.
Experts say the current need is in more generalized medicine.
We won't need as many invasive cardiac surgeons as we might have 5 and 10 years ago. Instead of sometimes surgical procedures, we're managing people medically or with drugs.
The federal health minister's office didn't comment. The department told us a task force is looking into the issue. Meanwhile, resident Ashley Miller says our doctors in training are a big part of the solution too.
We also have to build a culture in medicine of really social accountability and going where the needs are. Maybe picking a specialty that isn't necessarily your dream job, but that you'd be very happy doing, that serves a critical need for the population.
A prescription for change that could take years to fill. Shirlee Engel, Global News, Ottawa.